I would recommend that whoever's interested in nursing actually look into what's in their best interest for the area and what works for them, because work-life balance is super, super important when you're in nursing, because you have to make sure that you're not 100% dwelled into work and that you're not 100% dwelled into home. It has to work-life balance.
Hello, and welcome to the Job Dictionary podcast. Today, I will be interviewing Janet Zuniga to learn more about what it's like to work as a clinical nurse coordinator for the ER department for the company HCA. Janet, welcome. We're super excited to have you on today.
I am super excited to be with you, Alexia, today in this podcast. Excited to
Yeah.
have questions to broaden the knowledge of everybody seeking a job out there.
Exactly. So we're super happy about that as well. To start off, we always like to start with these three questions, which are just in your own words, what do you do? Where do you live? And as a kid, what did you want to be when you grew up?
Okay, so what do I do? I work in the emergency department. I'm actually a nurse. I'm a registered nurse, and I do hold my bachelor's degree in nursing. So to the gist of it, I'm a nurse. So I live in Bronzeville, Texas, in the southern tip of Texas, which is a few minutes away from Mexico. We're actually a border town, and we are very close to the island, which is our beach area. I love this area here, and we're
Yeah.
also venturing into the whole SpaceX era. So
Mm-hmm.
to have Elon Musk in the area down here. So this is a very nice city to live in. It's up and coming. It's growing. I've always lived here since I was young. I was born and raised here. I don't
Mm-hmm.
plan to go anywhere anytime soon. I love the area. And when I was young, I didn't really have an idea of what I wanted to be when I grew up. I only started to kind of get the gist of it, what I wanted, what interests me, when I was in middle school or high school. Maybe a teacher. I had a teacher in high school, Miss Montalvo. To this day, I will always remember her. She
Yeah.
as a class to kind of learn more things, and I started venturing to healthcare in high school, and that kind of got my attention in kind of in high school. But I didn't know whether I wanted to be a teacher or a nurse. So,
Yeah. So it started kind of like in high school for you. And then since then, kind of on the journey to where you are now, how long have you been working in this field?
Well, I've actually been a nurse. I didn't go back to school until my late 20s. So I've been,
Mm-hmm.
I'm going on 13 years being a nurse. I started in the med search department. I started as an LVN first in school, and then I transitioned rapidly into the RN role. I graduated, and then my first job, which is actually only being my only job at Valley Regional because I love it there,
Yeah.
uh, has been in the med search department for about 7 years. And then right before COVID, I transitioned into the ER department, which if I would have known better earlier on, I would have been there since day one. I love the ER. It's exciting. You learn a lot. Every day is different. And with that said, it brings a lot of challenges to my role. Mhm.
Right, I can imagine. So that's kind of like a really, really different things being thrown at you, different departments for this job. You said that you have your BSN. So are there certain degrees or certifications that are required to get into a position that you do?
Well, as a nurse, you just are required to have your in the med search floor. You have to have your license. Of course, you can be an LVN or RN to be working at the hospital. They prefer to have RNs because there's certain things that you cannot do as an LVN. Now, with that said, in the medical floor, you are required to have your ACLS, your Advanced Cardiac Life Support certificate. Is like a CPR kind of a deal, but it's more
Okay.
extended depth. And now in the ER is very different because you get all sorts of patients. So you have to have certain certifications to be able to manage care safely or to offer the best appropriate care for your patient. You have to have your ACLS. You have to have your TNCC to take care of your traumas. You have to have
Mhm.
house to take care of your pediatric patients that walk through the door. They have emergency situations when they stop breathing, when you have to intubate them, when you have to take care of them. You have to have your ENCP, which is also when you have your pediatric patients that have traumas. To be able to care for them appropriately, you have to have those trainings and those certificates in order to be working on the floor. You don't have to have them as soon as you start working, but within a 6-month gap, they offer those courses. They're paid through HCA and Valley Regional in order for you
Okay.
to up to par to care for those patients.
Right. Wow. So a lot of education, a lot of hard work and discipline goes behind anything in the medical field, really.
Absolutely, yes.
Are there any other job titles that this position goes by? I know you mentioned some at the beginning. Don't know if you want to go through those again, or is it mainly just clinical nurse coordinator?
So clinical nurse coordinator is a mouthful. It's
Yeah.
we say CNC. Most people don't know that phrase. They know the charge nurse or the
Mm,
nurse leader. So pretty much you're the captain of the ship, like they say. In order for you gear it correctly, there's a you coordinate care between the patients, the nurses, and the physicians in the ER. As a CNC, charge nurse, nurse leader, uh,
hmm.
coordinator, like I said, you have to coordinate the care between the patients, the physicians, and the nurses. That's really what your job description is there. You do bedside care because at the end of the day, you are a nurse and you are required to be a nurse with this role
Right.
because any given point, you can have a surge of volume of patients and you just don't wear that hat as a CNC. You have to be
Right.
able to draw blood, take the patient to the restroom, clean up the patient. All those roles that go into being a nurse, they're just fall right under the CNC because I can
Right.
one moment I can be the nurse leader delegating tasks or assignments to the primary nurses, and in the next role I'm helping the physician code a patient that because our other nurse is in another room. So you have to be able to deliver to care and be able to do all those things above being the CNC. You know what
Definitely, kind of just wearing all these different hats. I would say that the basis of it is an RN, a registered nurse. That's kind of like the core. And then from there, you kind of just add things on to what you do.
I mean?
What is a day in the life like in terms of a CNC? So, kind of like start time, end time, the percent of your time doing solo work versus meetings, in office. What does that look like?
So it's kind of this is a tough question. Um,
Mm-hmm.
because the way I did it is you have kind of like a routine. For example, me, I get to work, I get there at 6:40. Uh, you have to get report from night shift
Okay.
from charge nurse from that CNC from the night shift that goes around. You see how many patients you have, the acuity of the patients, your staffing for that day, your text for that day. So in reality, it's not just assigning roles. You have to be able to see, okay, so we have a certain amount of rooms. Let's just say we have 20 rooms, right? For an example, but we have five nurses and we have X amount of critical patients that are, they had an auto accident, they were intubated, they had a cardiac arrest overnight, etc. So you have to be able to get report from the nurse, assigned nurses based on the acuity for the patient, and
Right.
be ready for anything else that comes. So that's just part of the first 10-minute window before 7 o'clock.
10, it hasn't even hit, you haven't even had your coffee yet. You're already doing all of this.
Yeah, my coffee before and after and during the day. Like it starts like in the morning, and then I get there, I have another one cup of Joe like around 9 o'clock, and it just goes throughout the day. So I have to be ready to be able for anything really, because as I'm walking to the EMS entrance and I see, oh my gosh, there's like 8 ambulances outside, or there's 2 ambulances outside, or I'm already thinking, okay, who am I going to have for the day?
Right.
What nurses are my senior nurses, and what nurses are my newer nurses that I can, help have them in either lower acuity patients, higher acuity patients. How am I going to balance the workflow for them today? You
Right.
know, being able to make sure that the priority is patient safety because
Mhm.
I need to make sure that that nurse is able to care for that patient safely, effectively, and that they're able to have their tools that they need for that day. So that's just the morning before the report. I'm already thinking all these things, right?
Right.
Well, so we get report. I get report, look at my board, see what's going on, do my assignments, right? And then we
Mhm.
hand off for the day. Our handoff includes counting our narcotics, making sure we do a walkthrough in the area, making sure that we have anything that was used overnight. For example, if we had a trauma and we are all out of intubation kits, or we're all out of equipment like tourniquets or anything that they have, outsourced for the night, we need to make sure that at the beginning of the day we have all the equipment that is needed to be able to function to the best that we can for the patient. So we go through that reround, make sure that the area is clean, because above all else, patients go in there making, they see us and they want to make sure that they are well taken care of, that how the area looks, because it's like,
Right.
and I always tell my nurses, I was like, if you go to a restaurant, do you want to see a dirty area or do you want to see a clean area? Are you going to
Exactly.
down and eat with a dirty kitchen, with a dirty table? No. Patients are the same.
Exactly.
They go in there, they're sick, and they're sitting there in a room that's small, and their vision is like this, just in that four wall area. And if they're there for 2 or 3 more hours, they're going to see every single thing that they can possibly see. And no matter if you took care of them, you gave them the smile, but if they see a dirty area, they're going to think,
Yep.
oh, the perspective is always, giving them the end result for the day. You know what I mean? Like, it's always,
Definitely.
if your area is not clean, uh, if it is not safe, if your equipment is not working, if it's broken. So those are the rounding things that we do in the morning before my night shift nursing. And then it doesn't take very long because we're used to doing it every day in the morning. Uh,
Exactly.
they
It kind
already,
of becomes habit.
it's like a natural flow. Okay, I'm looking, we're walking, we're talking, making sure that everything's there, making sure what we need to get for the day. So that's our morning handoff.
Mm.
And it's a lot, right?
That
A lot.
that is so much. All in one day, all in one shift, you're doing things that people could do in 6 or 7 shifts. So that's incredible. With all of that, what would you say that the majority of your day consists of task-wise? So you're doing all of these things. Would you say it's more coordinating, more bedside? What's like the biggest part of your day?
So at the beginning, when I transitioned into this role, it was kind of difficult for me because I was a bedside nurse for a really long time.
Okay.
Uh, I would spend most of my time bedside. I would be helping my nurses draw labs, help the patient to the restroom. But now, as the role is evolving and as our ER is growing, because now our
Mhm.
volume is increasing, it's my job is more
Got it.
coordinating, making sure that, and this is really the essential baseline of what a CNC is.
Mm-hmm.
Coordinating workflow, making sure that our metrics are met, making sure that labs and urines are sent in an efficient time, making sure that the patient has all the results that they need. If the physician is, for example, they're taking too long to discharge a patient because they're too busy with a trauma, making
Mm-hmm.
sure doc, don't forget that XYZ is pending a disposition. That way we can move in some of the patients that are outside. We have, let's say 10, we have a surge, we have 10 patients outside, we're full. So you're right, it is more coordinating as the day goes by, making sure the patients get taken care of quickly, efficiently, safely, and that they're happy at the end of the day with the care that we have given them. So
Most
that is what it is, making sure that our nurses are giving adequate care, safe care, that their lunches are getting covered, uh,
mm-hmm.
that they are good to give above and beyond patient care, not just, oh, here's your meds, let's go, and also coordinating the care that the doctors are doing for the patient. Is the patient okay with that physician? Did the physician explain to them the plan of care? Did the physician talk to the rest of the family? Did the physician agree on with the patient in reference to the disposition or whatever's going on between the patient and the doc is also part of my role. It's not just the patients. I have to be kind of the mediator between the nurses and the physicians and the patients. So it's all that layered up as far as coordinating the ER.
Most definitely. In this job, do you use any type of certain tools or technologies to kind of help make your job a little bit easier?
Oh yes, absolutely. Trackers. That's what we call them. They're trackers. They
Mm.
are boards. Patient signs up in the ER. We see them on the board. We use our Meditech system, our track read system. It shows up. Let's John Doe is coming in for
Hmm.
abdominal pain. We see, okay, we have certain amount of time. ER care is measured in time and
Got it.
measured by acuity, and so we have to measure all those metrics. So we do need a lot of technology. We
Right.
have orbits that we have to round on our patient. We have apps like iMobile that lab can communicate, or anybody within the facility communicates with us. So yeah, we do use a lot of technology. That's just what we use to function and to log in and to chart and to coordinate care. That's
Mm.
the gist of like the ultrasound machine, the anything that has to do with nursing, that's different. So we do use a lot of technology on the floor.
Lots, super packed. And this job as a whole is extremely packed, nonstop, very, very, very intense and very chaotic. This moves me to my next question, which is what parts of your job are most exciting or interesting to you?
Um, as I have developed this role in the ER, at the beginning it was like, oh my God, the trauma. Oh my goodness, let's look at what's going on with this bleed, or uh exciting things. Now, as those things are okay, one trauma is like this, one trauma is like that. Now, to me, what is exciting is to be able to see that smile from the patient, and that
Mm,
safety, security, satisfaction that they were well taken care of. And sometimes it doesn't involve a trauma. It doesn't involve that. It just involves a 5-year-old that was super scared because their finger got smashed through the door, and just being able to take care of them and to offer reassurance, to give them a little toy, the crayon book, or anything like that, that kind of sense like, you know what, this is what the baseline of nursing is
yep.
human contact, human care, making sure that their experience was not scary, making sure that their experience was great, and that they want to do this when they grow up, you know? Also, because I'm getting older. As
Yeah,
I
I love that. That's the most special part about doing anything in the medical field, especially in a position like you're in and in the department, the ER as well. But I'm sure that there's also a flip side to that and a lot of emotionally draining and challenging aspects to what you do. So, what are those like to you? What parts of your job are draining or emotional, or I don't want to say boring because I don't think a position like this could ever be boring. But what is that more challenging aspect?
My most challenging aspect, to be completely honest and raw with you, would be
Mm-hmm.
I have to, because I was in the ER with COVID, I did see a lot of death.
Mm-hmm.
So, did see a lot of emotional distress. And even
Right.
thinking about it brings me back to that time when I was very young in the ER, very
Mhm.
young nurse in the ER, and having to deal with that. I think, to me, the most challenging part is the when we have to tell the patients, "I'm sorry, we did everything we could, and there's nothing else that we can do." And just watching and being there for the families. Part of my
Mhm.
is to coordinate the care when the patient passes away. Uh,
Yeah.
Part of my role is actually asking, I am sorry, this is not a good time for you. What funeral home is it that we need to transfer your husband, your dad,
Right.
your grandfather? And that's heartbreaking, because again, you go back to this, these are humans, you know.
Mhm.
We detach when we're in the room. We're
Mhm.
running lines, running tubes, intubating, pushing meds. We detach, but when we all said and done, and we're not able to successfully, bring back life for the physician or stabilize the patient, then the physician goes with me, and I'm there to offer support for the physician, which is my role, and support
Mhm.
the family. um we coordinate that after, like calling the organ transplant facility. So that's a state law for us. Call the donation hotline for every patient that has passed away. We have to call the judge and notify the death. But with that said, we have to tell the family, I'm,
Right.
you know, there's nothing we could have done. And kind of going through the motions, and you can see that heartbreak, and you can see that sense of this can't be, uh,
Yeah.
you and it and it even more heartbreaking when they're kids, and
Yes.
when they're drownings or when it's a car accident or when it's an unfortunate accident. Um, that's the most heartbreaking part for me at work. Uh,
Mm,
that's the most challenging part because you don't want to show too much emotion, but at the
right.
same time, you want to be able to support the family, be there for the family. So I think to me, that's the hardest part.
Yeah.
Not dealing with the nurses, not dealing with the complaints, not dealing with the physicians. None of that is being able to be human and to be there for the family. It's difficult when you have to make sure you detach in order for you to, there's another trauma coming, in order for you to function, to give that best care for somebody else. You have to differentiate between being attached and not. I mean, and all it comes down to with time. Um,
Mm,
I do remember it at the beginning when I was a bedside nurse, I would have to go cry and
yeah.
be detached. But as you don't have time for that, you unfortunately you have to regroup, rethink, and give yourself a moment, but then be able to go into room 6. Hi, my name is Janet. I'll be taking care of you for today. When this
Right.
30 minutes ago. So those
Yeah.
that the emotional part of the job, especially in the emergency department, to me is the toughest one, and it's the most rewarding part, the emotional part. But at the same time, it's the hardest because you have to show humanity and compassion, but at the same time, you have to just keep on going and going and going. So I hope
Exactly.
but I think that was all over the place.
No, you definitely did. I can imagine how heavy that can get, but kind of like what you were saying, just learning to detach between who you are at work and then who you are when you go home. I'm sure even though that was a long process and took a lot of time and effort, that's essential to doing anything in the RN field because you see a lot of things and have a lot of rewards, but you also have a lot of challenges in the job.
Correct. Yes. Yes.
Yes.
Correct. Thanks. You
When it comes to your job, are you able to ever leave the office and take work home with you, or is it something that can only be done in office?
Well, as a CNC, which is a nurse leader, charge nurse, well, my job description is from when I get there and when I leave. There's other
Hmm.
things that I do, audits when I have my days there, office days. There's days when I do extra stuff. For example, I buy toys for the kids that are at work. I take
Hmm.
little things, that I do in my extra time off. Or haven't we created an ED closet, a closet for all the, I don't know, here in the Valley, it's different because we had a surge of illegal immigrants last year. So we had a lot of illegals that would come across the border and they were wet and there were little kids. Created a closet for patients that needed a change of clothes and things like that. Those are extra stuff that I'm able to kind of do at home and take over there. But in reality, in my role, most of 98% of my job is at work.
Got
Uh,
it.
and I make sure I decompress when I get in the car and I let everything out. And then I'm home and I'm mom. That's my
Yeah.
other hat. Or and wife. That's my other hat. So I have to make sure I leave that at work and not let it, kind of, trickle into the home life. So
Exactly.
actually, in my role as a CNC, most 98% of it is there, 7 to 7. My 12-hour shifts, that is it.
Yeah, so kind of clocking out of the office and clocking in into home. That's what it looks like for you every day. As a CNC, you kind of already mentioned this, but are other CNCs able to work flexible hours, or is it something that's more set hours, 7 to 7?
So our shifts are 7 to 7, day shift and night shift. We
Okay.
do have one office day. It's optional. You can do half a day, then it's just office, do audits, run reports, help
Mm,
kind of more management position. But it doesn't always happen. Most of our shifts are 12-hour shifts, whether
got
it's
it.
morning, whether it's a day shift or a night shift. That's how our nursing, everywhere you go, mostly in hospital settings, it's a 12-hour shift, 7 a.m. to 7 p.m.
Got it. Are there any busy seasons in this job? Is it something that's steady all year, or do you see a certain time of year that's the busiest?
I do believe that usually our flu season is a little
Mm,
bit more busiest. And also kind of like our spring break time. We have a lot of the younger crowd that comes in. There's more, partying going on,
Yep.
a little bit more drunk driving, because
Hmm.
younger. And also the elderly with the winters down here because it's usually always hot. And we
Yes.
do have a higher poverty rate on our elderly population, whether homes are not heated, where they don't have our proper healthcare follow-ups and things like that. So we still in our culture in the valley, we still have a high prevalence of uneducated elderly, um, poor healthcare follow-up care, or non-compliance. We have a lot of non-compliance with our diabetic population, our hypertension, cholesterol population, all of them, and that just anyone between the age of 40 and above really are like, I don't have it, or
Yeah.
I don't need to follow up, or I drank that tea, it's gonna go away, or the
Oh,
home rec.
good.
Yeah. So usually that population trickled with the winter season is the one that gives us a surge in volume.
Got
And
it.
fall, more or less, fall, winter.
Yeah, so different, kind of like different little time periods of the year, but more or less you're pretty steady. You get out of spring break and then you have the summer and then you have the fall and then you have the winter blues and the flus and all of that stuff. Um, Kind of moving on, I just wanted to ask, what do you think that people underestimate about this profession? If there's anything that you think some people may underestimate, what is it?
Profession or the role, nursing or the my role in as a CNC.
I would go nursing. Let's talk about nursing. What do people underestimate about that?
I think the emotional part of it. They
Mm,
underestimate how consuming it can be. Whether
mm,
you work in the emergency department, whether you work in the med search floor, whether you work in rehab or labor and delivery. I believe nursing is what it is, what the word says. You nurse, you
mm,
care, you give of yourself to
right.
others. That's what I believe nursing care is. Um, so a lot of our newer generations and younger crowd that comes into the nursing, they know the testing part of it. They know they're very smart. They know the technology. They know, um, they're very smart, uh,
Mm-hmm.
but they're not prepared to they're not prepared emotionally, socially. I think that most of the, um, and not just the young one, more the young ones, but I think that they underestimate how much socially demanding it can be, and
Right.
emotionally demanding it can be on a person.
Yeah. And then on the flip side of all of that, what is something that people overestimate about this profession? So let's go nursing again. What's something that people think like, oh, this is an overhyped assumption or extremely positive assumption, extremely negative? What do people typically overestimate when it comes to nursing?
Um, I haven't heard anybody overestimate uh, nursing. I do
Mhm.
feel that some people complain, or nurses say, "Oh, I don't get paid enough," or or I think that's a hype thing. I think that a lot of people think like, "Well, you don't get it paid enough," or whatever. And
Yeah.
I do think that that's a misconception. I think that depending where you go, depending how many certifications you have, how much overtime, I think that it does compensate, to what you get, what you do, and what you get paid for.
Right.
Um, that's one thing. I also do think that they overhype some of the stuff when they say like, "Oh, if you go into flight nursing, it's exciting and it's this and it's that." It's only exciting for the first couple of months.
Yep.
So to me, I think that you have to make sure that you're choosing the right path, that
Mm.
you're right department or area, because nursing is so vast. So a lot of nurses, new nurses, think that the ER is the most exciting thing in the world, and that's a lot of it is, but
Yeah.
it's also very emotionally demanding. Now,
Mm-hmm.
for example, pediatrics, they think, oh, you're the babies, it's gentle, but you only have the babies for a little while. And
Yeah.
I think pediatrics is very critical. Very, you have to catch babies, don't give you enough. So I think that misconceptions go or hyping up is deferred to different departments per se. I don't know if I'm answering that correctly.
No, you definitely are kind of just knowing where to fit. And I think people kind of come in thinking as long as they're a nurse, they're going to be happy and they're going to be satisfied. But like you said, it's so vast. There's
Yeah.
so many different things you can do in the nursing profession, let alone the medical profession. So, yes, you definitely answered that question. What is the fastest way to get into nursing, especially if someone kind of has a non traditional background? They're fresh out of school, fresh out of getting the BSN. What's the fastest way to get into it?
To get into the nursing field, or like well, I started in high school with my CNN for
Mm,
by nurse aide. I think that's what it's called then. I didn't go back to school, like I said, into my late 20s. And then I did my LVN, and I rapidly transitioned into the RN. And then
got it.
I just during I worked for my BSN while I was working. So
Okay.
nursing is continuously evolving and learning. So there's no rapid way into saying this is the fastest track. I know most
Mhm.
of colleges want to do a 4-year program, which is bachelor's in nursing, and then you go and apply for the job, and you're supposed to be ready for it. Teach you textbook, they teach you all these things. I there's If you want to be exposed to it and make sure that this is really what you like, start off with an LVN, start off with the RN and work towards it. Those are options as well. There's also options in some areas where you can go into um hospital settings, like I'm not sure if Valley Baptist still does that, but they would offer the LVM program, and
Okay.
you LVN, and then you start working, you do your RN. So there's a lot of options. There's not just one sure way. This is a 4-year program. Let's get into it. I would recommend that whoever's interested in nursing actually look into what's in their best interest for the area and what works for them, because work-life balance is super, super important. And when you're in nursing, because you have to make sure that you're not 100% dwelled into work, and that you're not 100% dwelled into home. It has to work life balance. So if you can balance that out while you're in school, then that is your safest bet. If you need to be working and you need to be in school, that's really what you're going to be doing when you're in nursing.
Right.
So there's like you said, there's 4-year programs, there's 3-year programs. Um, at the end of the day, you are going to have the same license, whether you went to UTV, whether you
Mhm.
went to a technical school. It
Mm,
is the same test across the board for everyone. What nursing does to make sure that you're competent to be on the field, and that you're competent to safely take care of that patient. And from there on, it's just a beginning starting point, because, like I said, nursing is evolving.
mm.
You new every day. There's always a new medication. There's always new equipment. There's always a new technique. So when they say, "Did you pass your NCLEX? Did you pass your state board exam?" That's just like it's not the finish line. That is the
Yep.
start line. That's definitely the starting line. Don't be afraid to start in a local college or in a local community. You don't need to go out of town. You don't need to go to PSA, or whatever is the highest passing score. At the end of the day, you're gonna all have the same license,
Mm.
and they're sure that you're safe, that you're competent to take care. It's like I tell my nurses who are on the floor when they're orienting, they don't know the difference between Alexia, who is the new nurse on the floor, and Janet, who has 12 years experience.
Mhm.
That
Definitely.
they go in there with the perception that they're going to be taken care of, and yes, and they're going to be safely taken care of and the appropriate given. And that's what the license do. That's what the board exams are for. It's a
Right.
beginning point, yes, and the experience, you get it while you're working.
Exactly. It's just kind of like you were saying, it's always evolving. There's always new technology, new this, new that, new sicknesses, I mean, COVID is a perfect example. Just always something new, right? So you can't really prepare. You just have to be in it.
Exactly. And you learn as you go. You learn from your senior nurses, you learn from physicians, you learn from patients.
Mm,
Patients will tell you, when they'll tell you, like, nah, that doesn't work for me. Or, you know what, I was here 3 weeks ago, and I've been chronically sick for non-compliant diabetes. Do not poke me on my left arm.
yeah.
Poke me on my right arm. Listening. Making sure that you use your senses as a nurse. I always tell them smell, look, listen, and hear because a lot of the stuff. It sounds funny because I told my new nurses, I said it's not everything that you learn on the book or textbook. When you walk the room, you say, "Hi, my name is Janet. I'm here to take care of you today." When they respond, you're checking: are they awake, alert, and oriented? How do they smell? How are they responding to you? Use your senses. You can tell like their hygiene. You can tell they're not taking care of if they're making eye contact. Those are like really important cues as you learn. For example, if they're not making eye contact, there's something else going on.
Yeah.
If it's a sex trafficking situation, where there is mental health situation, they're overly anxious and getting triggered. So it's really important that you just take those 2 minutes when you walk into the room and just
Yep.
before you go in there, be like, hi, and make that eye contact. Make sure you greet them, smell. I tell them like
Yeah.
smell the room. You can pick up as a nurse. It sounds funny, but I remember being on the floor and be like, oh my God, that smells like MRSA. Oh my God,
Yeah.
that's all oh my goodness, that's like C. diff.
That is crazy. I had never heard that before. So I'm really glad that you mentioned that because I'm sure we have listeners that are going to now use that whenever they go into, their first room and it's like, "Wait, Janet told me to smell." So I'm going to take a
If
deep breath right now.
you
Just reading that room.
you read the room, read the people, read your environment. I always advise, don't look at your monitors, look at your patient
Mm,
because our devices can fail, our pulse oximeters. And this we learned through COVID. Oh my God, my goodness. They will come and grab me. They're satting 80%. And I'm looking at the patient. I'm like, they're not satting 80%. They'd be blue, ash
yeah.
blue. They were satting 80%. Put it on the ear or put it somewhere else, mess with it. So I always tell the new nurses, look at the patient, talk to your patient, everything else, the charting, all that stuff comes second to that. But use your senses, your social skills, your emotional connection. If you connect for 2 minutes, that's it. The patient's going to leave happy. They were heard. Then you
Yep.
can do your job, you can do your assessment, you can do your charting, all those things.
Right. Let's talk a little bit about what are other fields that people are coming into, like people that are coming into nursing, into CNC. What fields do they typically come from?
Oh, we have in our department, the emergency department, like me, I was in
Mhm.
med for 7 years before I transitioned over. I
Got it.
transitioned over because I felt that I was getting, quote unquote, what they say, burned out
Okay.
from bedside care. Med surg is a little different from ER. ER, you see the patient for 3 hours and then you see another patient, and it goes on and on and on and on throughout the whole day. Your
Mhm.
patient is usually 4-to-1 ratio in the emergency department, and you can turn your flow very quickly. You can see a patient, and it's like I said, the ER is very much measured in reference to the level of acuity
Mhm.
uh, and also your metrics. So, for example, if somebody comes in with the sniffles, pretty
Mhm.
good in 21-year-old, the sniffles, had a fever and cough congestion, they're going to give that patient a level 4 because we're
Okay.
not going to have a lot of things we're going to do for the patient. So the patient's going to be in and out, in and out. So at any time, you can have that patient for an hour and a half versus having somebody who's really, really sick for 4 hours before they get an ICU bed.
Okay.
So you can see patients, a lot of volume of patients. You can turn your patients very quickly or very slowly. So when you're in the med surg floor, you're at bedside, and 7-to-1, usually it's like the patients are for like 3 or 4 days.
Okay.
So I think I went off on this, Alexia. What
No,
was your
no.
oh
Continue. Go. You can say whatever you'd like that kind of applies to something like this.
so so yes, going back to your original question, I kind of lost my train of thought. I thought of that one, went on too much. What was it again? I'm sorry.
No, that's perfectly fine. Don't even worry about that. It was just to kind of, which I'm pretty sure you answered it already, just to see what fields people are coming from before getting into the position that you're in. But you talked about med surge and you talked about your transition to ER. So I think you covered all the points.
So all the nurses are usually either brand new
Mhm.
off nursing school and they want to work in the ER, or they come from a different background, like me, like I said, med surg. That was the question you're asking about med surg. I don't see a lot of pediatric nurses going into ER. I don't see a lot of labor and delivery nurses going to ER.
Hmm.
I see mostly either new nurses or nurses that come from med surg, maybe neurostroke units that want to learn more because ER is very vast. So you learn a little bit of everything.
Right. How long does it usually take for somebody to get really good in the nursing profession?
That's a tough question because I thought I was really good.
You're like, until I found out.
Doing other things in the ER. So it's like I said, I think that the biggest challenge is making sure you're not always thinking I already know everything
Mm,
because you will be comfortable. I think that's the best way to refer it. You will be comfortable in your own skin, in your own set of skills within maybe a year.
mhm,
Um, you're of After your off orientation, you'll be like, okay, all right, I've seen this trauma. I already know these things. I already seen this code. It's always an algorithm for codes. It's always the same algorithm for stroke patients. The traumas will differ a little bit, but it's going to be doing this kind of the same thing over and over again with different little twists and variations to it. But as I got comfortable in one role as a bedside nurse, then I was pushed to another role. So
yep.
now another role. So it's not always to say that you're going to be sure all the time. You're going to be comfortable, but
Right.
it's always evolving. It's
Mm-hmm.
always learn either from each other, from the physicians, from a new equipment, from something that was rolled out, or you learn from the patients. To me, the most difficult and most challenging aspect of my job, like I said, is the emotional connection. And after COVID, now I've had to learn how
Yep.
to deal with more psych patients because we do see a lot of those patients that are in depression, suicidal ideation, suicide attempts, homicidal. All those things they all come through the ER. They have to be medically cleared, screened, and then they get evaluated by our tropical system, which is the mental health stuff. Then they get transferred out. So that's also a whole other aspect of nursing.
Yep.
Um, you have nursing oncology, you have nursing pediatric, you have all these things, but we also have the psych part of the nursing,
Yep.
psychological, which is to me is the most challenging one because there's a fine line between being insane and sane. So
Yes.
all capable and we're all able to cross that line. So being able to be in the opposite end of it and being able to kind of learn how to do it has been to me the most recent challenging aspect of my job. So it's always evolving, always learning, always being ready for the next challenge.
Right. I don't think it's necessarily like a set number of years, like, oh, in 5 years, I'm going to be really good at this. I think it's just rolling with the punches, going with it, experience, learning different things. Because even where you're at, you've done this for so long, you're still learning things, you're still getting better. So, kind of just experience is the main takeaway from that question.
Yes, absolutely. Mhm.
What does the typical promotion path look like? It could be in nursing or your promotion path to CNC from the highest position you can hold, and like, what's the average time that people spend at different levels?
Well, mine was a little bit expedited. My
Mhm.
experience was a bit different. So the average path would be you are, if you're, let's say, Alexis a new nurse, right? She's
Mhm.
doesn't have any background. Your path would be, let's say, a year. A year you would be comfortable. The second year you'd be a little bit more. You're going to start orienting other nurses. So
Okay.
you being oriented and being on your own to orienting others and teaching others. And then from there, you can be interested in being relief charge on the floor. You pick up more team lead kind of a role where you're no longer the new one, but there's either new techs, new doctors, new nurses that you kind of want to say, hey, well, let me help her out. Let me see what worked for me when they were orienting, what works for you, and they'll start in that aspect. So we will start noticing, hey, Alexis super engaging with her patients. she's much of a team player. We should ask her to help us being relief charge. And when you start learning that role, relief charge, and getting exposed to it, then we start training you and orienting you to be a full-time charge nurse or CSC, clinical nurse coordinator. But it
Right.
have to be, some nurses have been there for a long time and they don't want that role. They
Hmm.
they like taking care of that quote trauma, STEMI, anything that's on the floor, pediatric patients. So
It could be kind of up to them whether they want to keep advancing up the ladder, or they're perfect where they are, they feel comfortable, they feel like they're content.
that's correct. It doesn't mean that you have to be a CNC. It
Hmm.
doesn't mean that I have to be a manager. A director. It could be that what you're best at is what you're most fulfilled with. Because if you're happy where you are, is what you're gonna give to your patient. Uh,
Exactly.
you're happy at bedside and you're happy taking care of those. Always encourage getting certifications, for example, a certified emergency nurse. That gives you a different pay raise. That gives you $3 more an hour. So
Mm.
you have to move up to the next level. You can broaden your knowledge and still get paid more. You can do a differential shift and get paid more.
Yep.
Whatever works for you to be able to give more to the patient and function to your best of your ability and still have the work-life balance. What we're mostly interested in cultivating in our, at least in our department.
Exactly. That's awesome. Moving on to more of the financial side of all of this, what is the average salary for somebody at, we can do both, we can do year level and then a registered nurse. So you can provide a range, even if that's very broad.
So I am not sure what, since I've been there for quite some time, I don't even know the pay bracket for. I know that back then there used to be pay brackets. I don't know if they still have that, but I know that they're starting the new nurses at $27 an hour, I want to say.
Okay.
Uh, Depending if they're right off school, depending if they have background or if they're transferring from another facility or from another unit, they start them off as that. If you're just based on now, there's a differential pay for the weekends and there's a differential pay for nights. I think night shift gets $3 more an hour. I'm not mistaken, or is it two and then the weekend gets three or some, there's always differential pays. So
Okay.
not just going to take your $7, home an hour if you're doing your 36 hours, which
Mm.
by the way, days is full time. And that's the what is required to be a full time nurse there with HCA 3 days. 3 days out of the week, which is six pay days, 6 days a week. I'm sorry. Yeah.
Okay. Wow, that's good to know. Are there any books or resources that you recommend to aspiring either CNCs or registered nurses that you took advantage of that you recommend to others?
Um, I did a book called that is because of my role, it goes a lot into delegating
Mm.
and communication skills. So I think Critical Conversations is a very good book in reference to being able to delegate appropriately because it's a very high stressful environment because things need to get done very quickly. Sometimes communication is key. It's not what you said, it's how you said it,
Yep.
uh, and how you delegated the task. So Alexa can have rooms 6, 7, 8, and 9, but she doesn't see what I see. She
Right.
doesn't see that we have six EMSs coming and go outside with. So Alexia might feel that she's getting bombarded, might feel that she's getting back to back, back to back. So communication is essential. So if a person, to me, that's challenging as a person because of my cultural background and my upbringing, but I might be a little bit more biased to being less communicative than one of my other coworkers who's younger and she can talk to a tree and make it chop down and make itself a toothpick.
Yeah.
She's very communicating. So identifying what you're lacking in and picking up a book, to me it was Communication Critical Conversations that helped me develop myself in my role as far as being able to be a better leader,
Right.
be more efficient as a leader. Um, but yes, you can pick up books like emotional reassurance. You can pick up books for skills if you're
Mm-hmm.
great at. communicating, like I said, my other coworker is great at. But she lacks the skills. So
Right.
to her, she might be able to have to broaden her knowledge in some skills aspects of it. And to me, well, I already have the skills part covered, but as a leader and as my CNC role, I need to be able to have those tough conversations with my nurse leaders, with my primary nurses, whether it's like, hey, Alexia, why didn't you follow up with the patient? Or we have set protocols. Why did you deviate from that? It is a patient safety issue. And not just go back and be like, Alexia, you did wrong.
Yeah.
You know what I mean? So
Yes.
it's like being able to communicate and have those conversations, tough conversations, but tough conversations are necessary for change. So yeah, but any of those books for me as a leader, as a CNC, is recommended. Mhm.
Perfect. I mean, that along with everything else that you provided us today has been wonderful, wonderful advice and insight. And you've mentioned things that I didn't even know existed. So I'm sure a lot of our aspiring people who want to go into the nursing field can learn so much from you today. To just kind of wrap up everything that we talked about today, what would you tell your younger self when you were at the beginning of your career?
My younger self, you got this. You can do this.
Oh.
And you're learning, and it's okay to doubt yourself.
Mm-hmm.
Sometimes at the end of the day, we're all humans. We're all
Right.
here for patient care, uh, to give the best of ourselves, not just as a nurse, but as a person. And I
Mm-hmm.
have learned so much throughout COVID and throughout being bedside nurse that, just reassuring myself that I'm doing good. But that that's part of my personality. I'm always striving to do more and more and more. But if I had to tell myself at the beginning, just reassure myself, you got this. You got
Yeah.
this.
I
Yeah.
love that. Well, thank you so much for being with us today, Janet, for giving us an hour of your already super packed days. We greatly appreciate it. I know that I learned so much. I know that our listeners are going to learn so much. So we loved having you on. Thank you very much for your time today.
Oh, you're welcome. I'm super excited for the job dictionary, and I hope that it broadens everybody's perspective as far as what CNC/charge nurse leaders do. And I was so happy to join you on this podcast and on this call and on this interview. To me, is as an older nurse, I feel like, oh my gosh,
Yeah, full circle.
that's right. Well, thank you so much for your time, Alexia. It was a pleasure.
Of course. Thank you.
You just got one episode closer to learning about the world of jobs out there. To explore the rest of our career categories and find your best fit, go to jobdictionary.com to sign up for the beta users waitlist. Then subscribe here to find the next episodes coming out this week. And as always, drop us a comment, review, or message to let us know how we can better attune our episodes to your specific needs. Follow us on TikTok, Instagram, Facebook, LinkedIn, X, Threads, Pinterest, and wherever else you're on socials to go get our short, snappy preview reels that expose you to new job options every day. Because here at Job Dictionary, we believe your big aha moment can be just one scroll away. Go check it out and get out there. Cheers!